Hi, folks. Thanks so much for tuning into this talk. My name is Hannah Boettcher. I'm a clinical psychologist at RICBT. And today we will be learning about something called interoceptive exposure. This is a cognitive behavioral technique that's really useful to have in our repertoire when we're treating anxiety, panic attacks, some types of OCD, and really any mental health condition where physical sensations play a big role in anxiety and avoidance. Thanks for tuning in. I'm going to share my screen now so that we can follow along with my slides. Give me a moment here. All right. So when you hear the word interoceptive, you can think of internal and perception. So interoceptive refers to any perception of an internal physical sensation that's happening in your body. And in our context, we're talking specifically about the types of sensations that tend to go along with strong emotional experiences, because these are so often the ones that we want to work on from a mental health perspective. Interoceptive exposure is a CBT skill for changing how we relate to physical sensations associated with strong emotions. This is your sweaty palms, your racing heart, your shaky knees, anything that tends to come up when you're feeling anxious, angry, sad, or anything sort of emotionally intense. These are, of course, things that most of us don't love to feel, but as we're about to talk about, interoceptive exposure is not about getting away from these sensations. It's actually about the opposite. It's getting more comfortable feeling the physical sensations that we don't like so that we can build a tolerance to being with them, sitting with them, and not letting them run our lives. So before we get into the how of interoceptive exposure, let's start by acknowledging the role that physical sensations can play in mental health. All emotional experiences have a physical component, and we know this for a couple reasons. We know it from laboratory research. There's actually psychology studies where you can put somebody in a lab, show them some sort of emotion-provoking stimulus, like a video that's designed to make you angry or anxious, and observe changes in their body. You can watch their pulse change rate. You can notice that they become more sweaty on their skin, notice changes in breathing. And you can also observe this from a first-person perspective, that when you're feeling a strong emotion, your body changes, right? Imagine being anxious or startled or furious and not feeling anything inside. It doesn't really make sense. Usually you'll find that physical sensations that come up with a strong emotion relate to the function of that emotion. And here's where we get into a quick sidebar on evolutionary psychology. So you might know that that natural selection, the theory of natural selection, whereby the traits that help with survival are selected for over time, that applies to mental psychological characteristics too. And strong emotions in humans evolved to serve a survival purpose. They evolved to help us do the things that made our lives better and made us more likely to survive and thrive. When you think about our, ancient ancestors on the savannah, you can imagine the difference between, let's say, two early humans, one who's prone to being anxious, being cautious, having a strong physical reaction when he, sees a predator or hears a noise. This is the guy who's gonna run away when there's a potential threat. And then another guy who's not as prone to anxiety, who doesn't feel much when he's around a predator and hangs around the lion's den. Guess which of these people is likely to survive longer, right? So in an evolutionary context, having a really strong reaction to our emotions was a survival advantage. And this is still how we are wired. Now, the physical component of anxiety and fear serves that survival purpose directly by getting your body ready to cope with a potential danger, right? So you might have heard of the fight, flight, and freeze response. This refers to a set of physiological changes that happens in your body when you perceive a potential threat. So there's an activation of the sympathetic nervous system, which is part of the autonomic nervous system. This is like a rush of adrenaline, racing heart, blood pumping, faster breathing. This is all to get blood to your major muscle groups so that you can fight, flight, flee, run away, or freeze. Stay still, don't move a muscle, survey the situation, don't attract attention. These are the sorts of moves that an early human in danger would have had to do to make sure they survived. So you can see here the connection between the purpose of anxiety and fear, which is threat detection and protection against threats, and the physical sensations that come up when you feel anxious and afraid. Granted, this was useful back in the day when our ancestors lived in a world that actually was full of uncertainty and a ton of serious physical danger all around. It was a good thing when those guys were afraid of a random noise in the middle of the night, because in all likelihood, it could be a threat to their lives. But for us modern humans, this is no longer such a helpful tendency. In most cases, when we hear an unexpected noise, it's like the refrigerator turning over or something like that. But we're still hardwired to have this kind of arousal response to a potential threat. And this is oftentimes what drives a lot of sort of sensitivity to feeling anxious in anxiety-related disorders, because we don't like how we feel when we're perceiving a potential threat, even if it's not physically dangerous to us. Okay, so that's just some background here. Let's talk about the types of sensations that come up with other types of emotions. We just covered anxiety and fear, and those sensations are tied directly to this fight, flight, or freeze response cycle. It's a lot of the physical arousal, getting ready for action. Now, anger oftentimes feels very similar to anxiety, feels similar to the fight aspect of that arousal pattern. So you'll get a similar sort of feeling in your body, maybe like heat sensations or shaking or racing heart coming up with anger. Sadness and depression, of course, feels a little different. It's oftentimes your heaviness and your lethargy and feeling weighted down, sometimes tension headaches coming up. Disgust can bring up feelings of like nausea, dizziness, sometimes heat sensations, GI distress, that sort of thing. You'll notice one of these on here is dissociation. I put that on there because it's one that's pretty uncommon, but also scary for people, but it's not dangerous. So I just wanted to mention it. Dissociation is a physical sensation of unreality, either that you and your body don't feel real, like you feel disconnected from yourself, or like your environment doesn't feel real, like it's at a distance. And dissociation symptoms are, well, I guess I said they're rare, relatively speaking, but within anxiety sensations, they're pretty common. So if you're having a panic attack or another strong, intense experience of anxiety, it's not unusual to then have that dissociation symptom come up. But it's perfectly safe. Just a little startling if you haven't experienced it before. All right, so knowing that physical sensations do come up with a lot of strong emotions, let's talk about what we want to do about that. And in order to have that conversation, we got to review exposure therapy, which you probably know a fair bit about attending this talk and being involved in the OCD community. But if not, it definitely bears a bit of review because this is kind of the heart of what interoceptive exposure is about. So generally, exposure therapy is deliberately contacting any distressing situation or trigger instead of using avoidance, escape, or any control strategies to cope with that situation. It's kind of like the clinical psychology jargon for face your fears, right? The conventional wisdom of facing your fears. It means, purposely getting in contact with these distressing situations instead of using avoidance, like I said, because avoidance doesn't actually work very well as a long-term strategy, which I'll explain in a moment why that is. Doing the opposite, though, of avoiding, getting in contact on purpose, it lets you build up a tolerance to being with a distressing trigger or situation so that you can have the freedom to not avoid it, so you can do more things in life even when there's discomfort there, and so you can build some confidence and self-efficacy about your ability to handle things even when they feel uncomfortable. Let's be perfectly clear now about why avoidance backfires. This applies to avoidance of physical sensations and avoidance of anything else that's not dangerous. So take a look at this sort of outline here, and we'll walk through it step by step. Now, granted, I said a little earlier when we were talking about evolution that the guy who runs away from the predator survives. That is true, and avoidance is useful when the thing you're running from is actually dangerous to you. But again, what we're talking about here is when it's not dangerous and it's a sort of a problematic cycle of avoidance. So let's imagine that the trigger for your avoidance cycle is an intrusive doubt. And if you live with OCD, you have probably experienced some intrusive doubts in your life. These are the thoughts that come out of nowhere, that are oftentimes repetitive, unwanted. And in this case, the intrusive doubt is a what if thought. Let's say, what if I didn't lock the door? So you're going about your day and your mind goes, what if I didn't lock the door? And then you interpret that trigger, that thought, as threatening, right? Maybe you say to yourself, like, oh my God, like maybe I didn't lock it. I can't sit with this uncertainty. I can't not know whether the door is locked. This is awful. I hate this feeling. If somebody breaks in and I didn't go back and make sure that my door was locked, then that'll be my fault. I can't handle this. So that's your threat interpretation, which is like, I cannot be with this thought. So then, of course, you do something to avoid or control that feeling. And in this case, you'd probably go home and check your door and make sure that it was locked. But then if the thought comes back later, was I sure I locked it? Did I remember that correctly? Then you may check again. And the tough thing about these avoidance or control strategies is that they do work in the short term, right? They make you feel better. In this example, you get the relief of saying like, yeah, it was locked, or thank goodness I went back because it wasn't and I fixed it. But the feeling of getting certainty, or let me be more precise, the feeling of escaping from anxiety and doubt feels really good. That's the short-term consequence. That's that relief. In the long term, though, it backfires because it reinforces this threat interpretation, this idea of like, I can't be with this feeling. It really was a threat. It really was dangerous. Because avoidance feels good, you're more likely to do it again. You don't learn other ways to cope. Like in this example, you don't learn that you could just not know whether your door was locked until you went home, and that would be survivable. And oftentimes, avoidance can get in the way of living the life you want. If you're always going out of your way not to feel anxious or not to run into a trigger, that can be pretty limiting. The same thing applies to physical sensations. The more that you act like these are experiences that have to be avoided and escaped, the more they stay scary. So doing the opposite is what's needed, right? That's what exposure therapy is about, building up your tolerance to being with the discomfort so you can figure out what actually happens when you stay in the situation, test out your assumptions about that, so that you're able to be more free to live your life even when you're anxious, right? If you're constantly trying to stay calm or avoid getting your heart rate up or avoid feeling down or avoid getting angry or avoid anything, it tends to narrow down your repertoire of what you can do, right? So this is about being able to open up and be with uncomfortable feelings so that you can do more of what you want. And happily for us all, when you do exposure therapy repeatedly, it actually decreases the amount of distress that you feel over time. So it's not like you're feeling equally anxious forever doing these things. It actually does decrease over time, which you know from experience if you've done it. Or like any of us, we can think back to the experiences you've had where you were initially anxious, let's say, but with repetition, you were able to do the thing without feeling that anxious, after a number of repeats. So things like, driving for the first time or going on dates or like a kid riding a bike for the first time. These are the sorts of things that bring up nerves, but not forever. None of us like job interviews, for example, but you better believe if you were doing a job interview every single day for a month, you would be bored at the end of that month. It's not that you wouldn't care. It's not that you wouldn't need a job still and want a job. It's not like it wouldn't matter to you. And it's certainly not like you would start to like it necessarily, but you would be sure that you could survive that. This is a type of discomfort I can handle. That's what we're going for with exposure therapy. So let's bring it back to physical sensations, which is the whole reason that we're here. Psychologists have known from a lot of research that oftentimes it is a fear or sensitivity or reactivity or avoidance of certain physical sensations that's driving mental health problems. And let me give a couple of examples. So emetophobia, this is a fear of vomiting, which is actually pretty common, which you may know if you have it yourself. But if you don't, now you know. So oftentimes there's a strong fear of physical sensations in that disorder because it's all about when am I going to vomit or am I going to vomit? So a fear of getting nauseous or getting dizzy. Sometimes it's a fear of like getting too full. You'll feel the pull to avoid eating big meals or avoid drinking carbonated beverages. In panic attacks, this is like the classic example where fear of physical sensations comes up. It's fear of fear, right? It's fear of that fight, flight, or freeze cycle showing up because panic attacks are really scary and painful. And oftentimes when you have recurrent panic attacks and are kind of living in fear of your next panic attack, which we'd call panic disorder, that shows up as like monitoring your body to feel like, when is my next sensation going to show up? Being really watchful of your heart rate, your breathing, and getting scared when you feel kind of like the slightest sign that a panic attack might be incoming. In social anxiety, fears of physical sensations are often around being observed to be anxious. So like, what if they can hear my voice shaking? Or what if they see me blushing? Maybe you avoid like getting hot or sweaty because people will see that you're anxious. In health anxiety, we used to call it hypochondriasis, now illness anxiety disorder. You're likely to find some sensitivity to physical sensations that feel like they could be a bad physical experience. So like fear of like headache sensations because you worry that you're having, a brain tumor, or a fear of heart palpitations because you worry that you're gonna have a heart attack. Now, here's the difficulty with physical sensations, especially in comparison to like other sources of fear and phobias, is that physical sensations can't be controlled directly. Like you can't just say to yourself, don't get anxious, don't get anxious. Actually, this has been studied in research settings. If you tell people like, whatever you do, don't let your heart rate increase, you can't do it, because these are not governed by voluntary processes. So we need a different approach than just trying to suppress our physical feelings when they're driving a mental health problem. We need to actually take the approach of building an ability to be with sensations so that you can learn that you're able to survive them and that you can continue living your life in the ways that you want, rather than constantly steering around any possible triggers, which is ultimately not workable, like we talked about. All right. So maybe you're thinking now, like, why would I want to practice like being with physical sensations that are uncomfortable, like a panic attack? That's an awful feeling. And you would be right. A panic attack is an awful feeling. However, we should also acknowledge here that the constituent sensations that make up a panic attack are not in and of themselves awful. And this is generally true of physical sensations. This is that they're not intrinsically aversive. It's actually the interpretation of the sensation that matters. And that is what we're working on in interoceptive exposure. So imagine like watching kids on a playground, right? Maybe you're a parent and you can have watched your kids have fun. They're swinging on swings, they're going down the slide, spinning around on the tire swing till they're super dizzy, going down the slide super fast so their stomach drops, running around till they can't see straight. Or consider adults riding roller coasters, going to really jumpy horror movies, going out for a runner's high. These sorts of sensations are the same stuff that come up during experiences of anxiety and panic. Racing heart, dizziness, shortness of breath, getting hot and sweaty. But of course, they have different associations depending on the context. When you're on a roller coaster and feel your heart racing, what that means is like, I'm thrill seeking, I'm having fun. But when you're, on a plane or standing in line at the grocery store and your heart's racing, maybe that means I'm about to have a panic attack, says your brain. Or maybe that means I'm about to have a heart attack. Now, the good news is you can change these associations. You can change what sensations mean to you by creating new learning, by being with the sensations and realizing that they're safe and tolerable. And that is what we are about, so that you can go from relating to your sensations like, oh my God, my heart's racing, this is awful, or oh my God, I'm nauseous, I'm definitely going to throw up, and cultivate instead an attitude that's kind of like, okay, my heart's racing, or I'm feeling nauseous, and like, don't love it, not my favorite sensation, but it's one I've seen before and it's something that I can handle. That's ultimately the attitude that we're going for. One caveat that you might have been thinking of as I said all this is, what about those sensations that really are intrinsically unpleasant? Nausea is probably the best example of that, or like chronic pain. And those sensations, yeah, they're legitimately never to rarely ever experienced as pleasant, right? However, it is the case that the interpretation of those sensations matters. And in treating responses to those sorts of chronic unpleasant sensations, we would go for the very same thing, changing the relationship to the sensation by, instead of like reacting to it like you got to push it away, and it's like the worst, most catastrophic feeling ever, you would cultivate a more accepting sort of like being with the sensation attitude. And that can actually decrease the distress even to those intrinsically aversive sensations. All right, so let's recap so far. Interoceptive exposure is about learning that unpleasant, unwanted physical sensations are still tolerable and safe, even if they're uncomfortable, for the purpose of reducing your urges to avoid and escape these sensations and avoid and escape triggers to sensations, which can really narrow your life down, and increasing your ability to continue just acting effectively and living your life when uncomfortable sensations show up. So that getting away from your feelings doesn't have to control your behavior. All right, so how do we actually do this? Well, it's straightforward, but it's not easy. It is doing physical exercises that bring on the sensations you're afraid of or avoiding over and over again. Whoops, wrong direction. So let's imagine how we would prep for interoceptive exposure in therapy. So let's say I'm your therapist. We would want to first identify the sensations that you are afraid of or avoiding. What feels most threatening to you? This is where interpretations come in. So does dizziness make you feel like you're going crazy? Does racing heart make you feel like you're having a heart attack, and so forth? Then we would go through a number of test exercises to see if we could come up with a physical exercise that would bring on those sensations that feel really similar to the way that you feel when you're anxious or emotional. So we would want to basically trigger the feeling that you're trying to get away from on purpose. And you can do this any way you want. There's like no limit to how creative you can get. If you don't like sensations of like getting hot and sweaty, you could put on a lot of coats and sit in front of a heater. If you don't like getting dizzy, you could spin in a chair. It's anything that reproduces the sensations that you're afraid of or avoiding. And I should say in really rare cases, I would consult with somebody's doctor to make sure that the exercises we're going to do in therapy are safe for them. But this is extremely unusual. I've only had to consult like once or twice over the course of many years. And they would only be for really specific instances where, like, let's say somebody had a history of heart problems and we were going to deliberately be messing with their heart rate, or a history of asthma attacks and we were deliberately going to be messing with their breathing. But in the average case of somebody who doesn't have a serious medical history and is just psychologically, afraid of the sensations, we wouldn't need to consult. Also, in preparation for doing interoceptive exposures, we would want to rate the likelihood of the worst case scenario outcome that the person's afraid of. So things like, how likely is it that you think you're going to have a full-blown panic attack from doing this exercise? How likely is it that you'll have a heart attack? How likely is it that you'll die? And it's whatever the person's afraid of, because we want to ultimately go for changing that expectation with new experiences of the sensations. All right, so let's put this in terms of an example. Let's say that you're afraid that you're going to stop breathing. This is a pretty common fear in panic disorder, in somatic OCD, which is like where obsessive compulsive cycles take hold of like somatic bodily sensations. And in health anxiety, this could be a common fear as well. So we would identify the sensations you're afraid of, which is probably shortness of breath, maybe some chest tightness, shallow breathing. Your feared outcome in this case would be that you would stop breathing, of course. And the types of exercises we could do together would be things like running up and down the stairs, holding your breath, hyperventilating on purpose, like that's the sort of exercises we would do in session to bring up those feelings like, what if I stop breathing? The idea would be that you could get to a place where you realized feeling out of breath isn't the same thing as actually stopping breathing, so that you could stop avoiding things like exercise or taking the stairs and start becoming comfortable with sort of the natural range and fluctuation of your respiratory system as you go about your life. I would, like I said, ask you to predict how likely it is that you would stop breathing. That's like as a percentage, like 1 to 100. All right, so let's see. A couple more details about doing interoceptive exposure. Like I said, would be picking an exercise that brings up the sensations you've been afraid of or avoiding. And then we would do it repeatedly. So this is not a one-shot deal. We're actually doing many trials in a row. So that's like repetitions. And we would go for 60 seconds at a time without taking breaks, except to make your ratings of how anxious you were and how much you felt like you were going to have your worst outcome happen. Oh, and I'll also ask you how much you could tolerate the fear, going for this idea that even if the sensations stay the same, you can still build up your own tolerance to them. And we would keep going until your expectation of your worst outcome was at 5% or lower, or until your willingness to tolerate those sensations was so high that you were no longer doing any avoidance or escape strategies. In other words, it wasn't getting in the way of your life anymore. That's what we would be going for. And here's what we would expect to see with repeated interoceptive exposures. We would expect that your distress, your anxiety level, would decrease with repetitions. And that's even if the intensity of the physical feelings is unchanged, they wouldn't bring up as much distress. That's again, back to the idea of interpretations matter. It's not the absolute intensity of the sensation per se, it's how you feel about it. And that's what we would expect to actually get easier, that your anxiety and distress would go down. We would also expect that your fear toleration would go up. So if I were to say like, how willing are you to feel this feeling? You know, not that you like it, but can you be with it? That sort of thing. That would increase with repetition. And then also that your perceived likelihood of your worst outcome happening would go down with time. And that's because it typically doesn't happen. In the case of folks whose worst outcome is something that does happen routinely, like maybe throwing up or having a full-blown panic attack, what we would be going for is an increased willingness to tolerate that outcome, even when it shows up, kind of like decatastrophizing the idea of having your worst case scenario happen. Another point about interoceptive exposure is that when you do these exercises designed to bring on physical sensations on purpose, you want to be watchful of subtle avoidance behaviors. Actually, this is true for any type of exposure therapy, whether it's like a fear of spiders or a fear of your heart racing. Subtle avoidance is when you're in the triggering situation, but you're still kind of doing stuff to like kind of keep it at arm's length and to not kind of feel the full extent of the feelings. This undermines the exposure because it plays into the idea that this is like fundamentally threatening and bad, and like we really have to like not get too close to it kind of feeling. And examples of subtle avoidance. Oh, I didn't put enough context in that second bullet point. That has to do with subtle avoidance for breathing through a straw, which is what we're about to do really soon. But examples of subtle avoidance there would be like going super slow, like cheating on the exercise or stopping in the middle. Okay, let's do it. So I'll ask you to join me in straw breathing, which is breathing through a straw where you're only taking air in through the straw and not around it and not through your nose. So if you don't have a straw, legitimately, you don't have a straw in your house, you can do a different exercise here. When I do this straw breathing, you can do like jumping jacks or spinning in your chair or whatever you think might bring up an uncomfortable sensation for you. But straw breathing is one that gets a lot of people and that definitely brings up physical sensations for me. So I think we should all try to do it if we can. I'll pause, I guess, to let you go get a straw. So, or actually, no, you pause this video, go get a straw, and then come back. Okay. So you have your straw or you have another exercise picked out. you'll want to figure out what would be your worst case outcome that you'd be afraid of. Maybe it's like, I can't breathe through a straw for 60 seconds, like I'm gonna have to stop. Or maybe it's like, I'm gonna stop breathing, or I'm gonna have a panic attack. You could even rate the likelihood that I will stop breathing as I breathe through a straw on camera, as if you're not doing it with me. So we just wanna make a mental note of what's the likelihood 0 to 100% that we think this worst case scenario will happen. Let's see. Okay, so you're gonna want to take air only through the straw, right? So it'll be like this, and plug your nose so that you don't cheat through your nose. I'm gonna set a timer on my phone for 60 seconds, and we're just gonna breathe through the straw for a minute, okay? All right. Okay, so we've got this, and we're gonna go ahead and start. Okay, there's my alarm going off. All right, we did it. So we breathe through a straw for 60 seconds. Let's pause and check out the physical sensations that are coming up. And please check this out in your own experience. For me, I've got some chest constriction, and I've got actually some lightheadedness and a little bit of that dissociation symptom that I mentioned earlier, where it feels like things are a tiny bit unreal. However, since I have the benefit of doing this exercise a lot with people in therapy, I would also say my tolerance for these sensations is pretty high. So I would give my tolerance like an 80 or 90% for that one. I would say my anxiety was maybe at like a 4 out of 10. And no bad outcomes happened to me, at least. And so take a moment to review your own experience. Now, I said earlier, we would do this again and again and again. And there's actually been research on how to do interoceptive exposure most effectively to treat, in that case, it was like fear of panic attacks. And the best way to implement this in therapy is to do many repeated trials in a row until you've gotten your expectation of your bad outcome down to below 5%. And that actually did a better job of helping people's anxiety over the long term than like a lower intensity exercise of a similar nature. So if you only did this like once or twice and called it a day, that wouldn't be as beneficial as doing it repeatedly. Now, I won't take time to repeatedly do a bunch of straw breathing right now, but we're talking like 10, 20, 50 repetitions in a row. You know, this is not a once or twice thing. You could spend an entire therapy session or multiple sessions doing this. All right, so if your physical sensation fears are situation dependent, you're going to have to do these exercises in that situation. Let me talk through some examples. Imagine that you're someone who is afraid of like having a heart attack or stopping breathing when you exercise. But if your spouse is at home, you're like, well, I'm not anxious in that case because if I collapsed or something, they would like call an ambulance for me. In that case, you would actually want to do your interoceptive exposure exercises, probably like running on a treadmill or something like that, when you were alone, because that's the exact scenario that you need practice with. You don't need practice working out when somebody's watching you ready to dial 911. You need practice feeling those sensations in the context that scares you. And that would be so that you could do things like going on a run alone. We always calibrate the interoceptive exposure to a person's real world needs. We're not just doing these exercises like in principle. It's so that you can specifically get better at entering the situations that matter to you. Another example of situation-specific fears might be for social anxiety. So somebody with social anxiety might not like, let's say, getting hot and sweaty because it makes them look anxious, but that would only matter to them if they were about to be around people. So as a therapy approach, you might deliberately get hot and sweaty as an interoceptive exposure, like sitting in front of a space heater or doing some exercises, and then go like have a conversation or give a speech when you were feeling those sensations. If you're afraid of, let's say, throwing up because you find it humiliating, you might practice spinning around and getting dizzy and nauseated before getting on a plane, because then you would be trapped with people. And the idea here, we're not being sadistic. We're trying to be as helpful and targeted as we can to help the person learn that they can handle the sensations in the situations that actually drive their distress and avoidance. If you're somebody who's afraid of panic attacks when you're in like a space that you can't get out of, if you have some agoraphobia, which is like a fear of having an unexpected physical reaction when you're in a space that you can't get help or can't escape, like driving in traffic, for example, you could do some of these interoceptive exposure exercises, let's say right before you leave your therapy session, and then go and drive your commute home. And then you would have the experience tolerating that feeling when you were then in the context that was, most distressing to you. Relatedly, maybe you have multiple fears that happen to co-occur, and you can stack exposures. So like if you have claustrophobia, for example, which is like a fear of being in enclosed places without being able to get out, you could do straw breathing in a closet, which is what I did for my dissertation in graduate school. And everybody who participated was just fine. All right, so some more examples of interoceptive exposure exercises for specific sensations. You can see sensations over here on the left. SOB is shortness of breath. This is elevated heart rate. And then the types of exercises that we might do here on the right. Like I said, there's really no rules. It's like any exercise that can be done safely and that brings up the sensations in question will work. This example of eating hot sauce to get flushed and sweaty is really from psychological research. There was a research study where folks with social anxiety had to eat hot sauce before going into a social interaction for the purpose of building up their tolerance to those feelings of being hot and sweaty. Some more examples here. Let's see. So like dry mouth, for example, this is one not a lot of us enjoy, especially in social anxiety, because dry mouth can make it difficult to talk fluidly. So you could like blot out your tongue with a paper towel, or eat something dry like crackers, and then go practice having a conversation when you have that sensation on board. As you can see here with dissociation, remember those are the feelings of being unreal or your environment being unreal. There's some interesting research about how that can be induced on purpose for the purpose of building your tolerance to it. Of course, it's exposure therapy. You can look at your own hand at like extremely close range, can bring on dissociation for some people. You can look very closely into a mirror at your own face. You can watch one of those black and white spiral videos on YouTube that's designed to give temporary visual hallucinations, or look at a strobe light or another sort of unusual visual pattern. These all bring on transient feelings of dissociation. So really the sky's the limit is the point here. And we would tailor the exercises to whatever the person needed practice getting comfortable with. All right, so what if you're sitting here thinking like, okay, I'm not afraid of any sensations, that is not my problem. Well, first of all, you may be right. You certainly know your mental health the best, and interoceptive exposure does not apply to everyone, nor does everyone have to do it. However, if you're not sure whether physical sensations are driving any anxiety or avoidance for you, I would encourage you to try and see. Experiment with doing some physical exercises that bring on unwanted sensations and then just sitting with the sensations without doing anything to escape or avoid them, and see how that feels to you. I should also say that sometimes it's not a fear of the sensations exactly that's in play, but rather strong physical sensations can make emotional contexts feel that much harder to tolerate and can make a person more likely to do an avoidance or escape or control move when they're having, that unwanted emotional experience. So as an example, in depression, there's oftentimes a lot of feelings of heaviness and lethargy. It's not like somebody who's depressed would probably say that they're afraid of those sensations or that they think they're about to die or anything when they feel those sensations. But it's more like somebody who's depressed might say, it's harder to get up and live my life and go about my business when I'm feeling weighed down like that. So in that case, we could do interoceptive exposure to the feeling of being weighed down. You might have them put on like wrist weights or ankle weights and then go about their tasks like doing household chores or answering emails while being physically weighed down. And here the purpose would be to practice doing it anyway, even when they felt heavy and lethargic, so that the next time that physical sensation came up, they wouldn't be so likely to withdraw, avoid, sleep, procrastinate, all the things that are so tempting to do when we're depressed. We would have removed the element of the physical sensations in driving that avoidance by building up tolerance to the sensations, even if they were never afraid of them. And the same may apply to OCD in some cases. Oftentimes, when your body is really revved up, it feels harder to do exposure therapy for your OCD, to do your exposure and response prevention or ritual prevention. Right? And maybe you've experienced this. If you're somebody who's done ERP, you know that it's harder to do exposures on days when you happen to feel nervous or sick or hungover or any sort of physical sensation that make your body not feel its best. In that case, there's a rationale for doing some interoceptive exposure in combination with your ERP for OCD. And the idea there would be that you could learn that you're able to tolerate, let's say, not doing a compulsion or ritual, even if you're having distressing physical sensations, not only on your best days. All right, so takeaways here. I guess I'll stop sharing so you can see me a little bit bigger. The takeaways that I'd like to send you home with today are really that physical sensations are an important part of a lot of different emotional experiences and may very well be a driver of anxiety and avoidance across lots of different mental health conditions. I would encourage you to get curious about this in your own personal experience, to watch for those physical sensations that you tend to avoid or escape from, and see if you can't experiment with the spirit of interoceptive exposure, which would be to stay in the situations that trigger uncomfortable physical sensations, merely tolerating an attitude or cultivating an attitude of saying, let's see what happens. Let's sit with this without doing an avoidance or escape move. So that does it for today. Feel free to reach out if there are any questions following this talk. Thanks so much to OCD Rhode Island and to Ryan for inviting me to speak to you all tonight. And I wish you the best, and let's go feel our feelings. Take care.